Hello, my name is Dr. Stanley Lang. Welcome to this video. This is a continuation in a series on videos on holistic health or whole person health from a family doctor's perspective. And today I'm going to talk about diabetes management using the ketogenic diet. In particular, I'm going to talk about type 1 diabetes, which we don't do very often. Family doctors see a relatively small number of type 1 diabetics because they're relatively rare. Type 2 diabetics are folks that actually have more than enough insulin and their body's resistant to their own insulin. Type 1 diabetics are severely insulin deficient. Today I was seeing a patient that I've been managing for some time who has type 1 diabetes and has been trying to use the ketogenic diet, and her blood sugars were bouncing around more than we would expect with the ketogenic diet, which normally helps to smooth things out pretty well. But what we discovered with her history was that she was eating basically too much protein for each meal and not enough fat. Now, that might seem to the average person as not a big problem, but when you're on the ketogenic diet, you have to watch your protein intake, because protein is broken down to sugar. And if you give the body too much sugar, it will default into its sugar-based metabolism, which means that you're not going to be in ketosis, which means you're not, the ketogenic changes that we're looking for with diabetes control just don't happen. And the other part of her problem was she just wasn't checking whether she was in ketosis frequently enough. So looking at her numbers, I really couldn't figure out exactly what was going on, but going from her food diary description, it looked like she probably was eating relatively too much protein, not enough fat. So that was the intervention we made, and I encouraged her to start checking her ketone levels a lot more frequently, at least for a while, so we can figure out more precisely. Now, normally, the ketogenic diet for type 2 diabetes works great to not only control, but in most cases, reverse diabetes. So if you've never considered the ketogenic diet and you're a diabetic patient, I encourage you to look at it. There are other strategies that allow you to easily reverse diabetes without the ketogenic diet. It just happens faster with it. So if you are on the ketogenic diet, the biggest mistake that people make is not getting too many carbs in, because they're already pretty conscious that they need to restrict carbs, but they're getting too much protein. And I'm sure that's what's happening with this patient. And if you're attempting to do the ketogenic diet, it's something to keep track of. It's easy to remedy by adding more fat. There's simple things to do with each meal to do that without changing the meal that much. So it's an easy remedy. Anyway, ketogenic diet, great diet for helping to regulate diabetes. If type 1 diabetics are usually in much better control, need much less insulin than they usually need. They bounce around a lot less in terms of their blood sugars. Type 2 diabetics literally can reverse their diabetes completely and get off of medicines most of the time, unless they've been diabetic for a long, long time. So I encourage you to consider it. And the third reason to consider it is, even if you're not diabetic, if you're pre-diabetic, it's a fantastic way to avoid diabetes, not to mention lose weight. So I wish you well, God bless, and have a great day.